we did comps for the region and did a fair market adjustment for our workforce. That certainly helped. And then the other is a focus on establishing a relationship with new employees. We found that we were having a significant number of people that were staying less than 90 days and then leaving our market, jumping to another facility, even for 25 cents more an hour. Establishing that relationship, letting the individual know that we value them, developing a sense of belongingness is key to having them stay within our facility and continue to grow.
What are your current priorities thinking about today in 2024?
Growth, of course, cost containment, and retention. Certainly over the last 2 years, a large focus has been on eliminating traveler positions, PRN positions, and moving towards strong, established, consistent workforce.
Can you expand a little bit further on what your growth expectations are?
Yeah, we have a hyper focus on neurosciences, cardiothoracic, and orthopedics. So those are our growth strategies. We look at what is the regional community need for different specialties. So we can see that there's a large community need for primary care, but what are the other service lines in which there is a noticeable community shortage and recruiting to meet the community needs? For instance, our region is 11 or 12 cardiologists short, and the wait time, whether it's our facility or another facility, is extensive to get in to see a cardiologist. Recruiting then to meet the community needs and the community demand will help develop a stronger market share.
Approximately how much do you expect outpatient procedures to increase in the next 2 to 3 years in your facility?
I would probably say 10 to 15% at the most, because most of the heavy shifting has already occurred. Ophthalmology, dentistry, orthopedics, they've already shifted over. Plastic surgery, we're shifting over. Everything else is related to increased capture of market share. So that's why it's 10 to 15%, not 30%. The shift has already occurred.
What can medical device companies do differently to improve how they support your hospital?
If we use your product, making sure that we have education of our providers, especially if it's a new product that we've just started utilizing. Data analytics, making sure that we have transparency on the skill set of the providers. If there is some product that is new to the market that has been tested and is beneficial, letting us know about that. What we need to look at, what are your outcome measures compared to existing, and what's the contribution margin? Sometimes we actually take a hit on the contribution margin if it actually is better for the patient. Looking at the things from those two sides, contribution margin and patient outcome, and providing us that information. If you want to get our attention, that will get our attention. Everything else, not so much.
What can digital health companies do differently to improve how they support your hospital?
If we go with any kind of new software, education and training of the provider, there's a whole lot of claims. Again, we mentioned it right when we very first talked about the billing and coding and potential increased revenue, or what we like to think of as getting paid appropriately for the work done. There's a whole lot of companies out there that say, hey, we'll increase your revenue by 25%. Just use us. We're the greatest thing ever. But actually being able to see that and experience that, that's where I think typically digital companies have not done.